Hi guys, welcome back to my YouTube channel. Today we are talking about the valsalva maneuver. Forced expiration takes place against a closed glottis in the abdominal straining associated with the micturition, defecation and parturition. Air is often held temporarily in the respiratory tract by closing the rhina glottidates after deep inspiration. The Rhinoglottis is closed and the muscles of the anterior abdominal wall now contract and upward movement of the diaphragm is prevented by the presence of compressed air within the respiratory tract. After a prolonged effort, the person often releases some of the air by the momentarily opening and the rhinoglottis producing a grunting sound. The voice production in the larynx. The intermittent release of the expired air between adducted vocal folds result in their vibration and in the production of the sound. The frequency or the pitch of the sound is determined by the changes in the length and the tension of the vocal ligaments. The quality of the voice depends on the resonators above the larynx, namely the pharynx, mouth, paranasal sinus. The quality of the voice is controlled by the muscles of the soft palate, tongue, floor of the mouth, cheeks, lips, and jaws. Normally, the speech depends on the modification of the sound into recognizable consonants and vowels by the use of the tongue and the teeth and the lips. The vowel sounds are usually purely oral with the soft palate raised so that the air is channeled through the mouth rather than nose. Speech. Speech involves the intermittent release of the expired air between the adducted vocal folds. The singing a note requires a more prolonged release of the expired air between the adducted vocal folds. In whispering, the vocal folds are adducted but the arytenoid cartilage are separated. The vibrations are given to the constant stream of the expired air that passes through the posterior part of the rhina glottis. The mucous membrane of the larynx. The mucous membrane of the larynx lines the cavity and covered with the ciliated columnar epithelium on the vocal cords. However, where the mucous membrane is subject to repeated trauma during phonation, the mucous membrane is covered with stratified squamous epithelium. Above the vocal cords, the internal laryngeal branch of the superior laryngeal branch of the vagus, and below the level of vocal cords, the recurrent laryngeal nerve, and these except the cricohyoid muscles are supplied by the recurrent laryngeal nerve. The cricothyroid muscle is supplied by the external laryngeal branch of the superior laryngeal branch of the vagus. And now we are talking about the lymph drainage. Here you can see a lateral view showing the internal and the external laryngeal branch of the superior laryngeal branch of vagus nerve. The distributions of the terminal branches of the internal and the recurrent laryngeal nerve. The larynx is viewed from above and posteriorly. Thank you so much for watching.